I'm Dr. Greg Allgood. I'm the director of the P&G Children's Safe Drinking Water Program. It's a way that we have to help eliminate the disease and death that occurs because of unsafe drinking water, and therefore meet one of the Millennium Development Goals.
Okay, so we're here talking about Millennium Development Goals, and these goals are meant to be reached in the next 5 years. And a lot of people say it's unrealistic that's going to happen. Do you think, what's your opinion on that? Do you think we can reach these goals, or?
I think some of the goals will be reached and others will not, unfortunately. We're making good progress in providing access to safe drinking water, for example, and that goal will probably be reached. But the goal to reduce childhood mortality by 2/3 probably will not be reached. We made great progress, but still more needs to happen. It's one of the reasons that we focused on something as simple as clean drinking water to prevent diarrheal disease. The top causes of death are pneumonia and diarrheal disease amongst children, and there are simple, scalable ways to prevent those deaths. P&G, working with the U.S. Centers for Disease Control and Prevention, invented a little packet of powder that takes even heavily contaminated water and makes it clean and safe to drink. It's called the Pure Packet, and it's a not-for-profit effort that we have to provide safe drinking water. We announced today that we're scaling up that program in order to save one life every hour in the developing world with clean drinking water. It means providing 2 billion liters of water every day, and the way that we're going to be able to accomplish it is through partnerships, with more than 100 partnerships with humanitarian organizations.
So this seems to be successful. What are other groups doing wrong? Why are we still so far behind with reaching some of the Millennium Development Goals that we want to reach?
Well, I think one of the things that the public health community could do a little better is spend the dollars on development more associated with the global burden of disease. Like, for example, pneumonia and diarrhea aren't funded equally to the burden of disease. They're the top 2 killers of children. Maybe they should be money for children's development, the top 2 ways that we spend money. If you think about it, more children die from diarrhea caused by unsafe drinking water than HIV/AIDS, malaria, and measles combined. Right? But there's a lot less money spent on providing safe drinking water than some of the other important health interventions. I'm not advocating spending less on those others, but certainly we should spend more on proven ways to prevent diarrheal illness from unsafe drinking water.
Are there any MDGs that you feel are particularly important that need to be achieved now?
Well, if you look at MDGs, one of the things that's interesting is 2 that are sort of cross-cutting, and one is empowerment of women, because not only can women help eliminate the poverty in the world, they raise the children, the next generation. So that's one. The other is water is cross-cutting, because water is a women's issue. It's women that have to fetch firewood to boil water. It's women that collect the water, sometimes walking 6 kilometers a day. And it's women that have to care for children when they're sick. So if we can have ways to provide safe drinking water, focus on water as a woman's cause, we'll solve a lot of the problems in development. Certainly not all, but make a big step forwards. One of the things we've done at P&G is start engaging our P&G brands, our mega brands, so that they can focus on these important goals. For example, this week, Pantene, one of the largest hair care brand in the world, has started a program called Healthy Hair for Healthy Water. And this is a program that in the future, when it launches, for every bottle of Pantene that's bought, it'll provide a day of clean drinking water in the developing world. Just one way that our brands are starting to help raise awareness of the global clean water crisis and simple ways to address it. One of the things we've seen is that when the young generation is informed, when we provide them knowledge, then they can be inspired to take action. We know that most people don't know that more children die from diarrhea than from HIV/AIDS and malaria combined. But if they learn that, and then they learn that there are simple ways to prevent those needless deaths, then they're inspired to take action. One of the things we've recently done at P&G is create the P&G Give Health Clean Water Bloggovation. We brought 35 influential bloggers from the web together and told them about the P&G Children's Safe Drinking Water Program, provided them with unique tools, widgets to reach out to their audiences. It was incredibly successful. Every time someone posted a comment, it provided a day of clean drinking water, and it reached 21,000 days of clean drinking water. This program reached 80 countries and inspired more than 3 million people to start building awareness. So we believe that with things like the P&G clean water bloggovation that we can inspire people to start taking action, particularly the young generation.